pain is a late stage indicator of a problem. And if you have had any sort of incision or trauma to your body, if you do not purposefully reintegrate movement into that area that has been, cut, damaged, changed, it's going to go somewhere else. Hey everybody, I'm Dr. Kirsten Wishloff. Welcome to this episode. We are chatting about the connection between abdominal surgery and back pain. Really what I want to start to draw together today is the idea that there is generally a cascade of events that leads to lower back pain. Generally, lower back pain does not happen without something happening before it. And it's really common because your back is a spot that can compensate for a lot of different parts and pieces in your body. And as someone personally who experienced a lot of back pain as a teenager, I was always really focused on the back and the core, which is not to say that that's incorrect, but I feel like it's a really big, broad puzzle to solve. It's not quite as simple as just looking locally, but it is an excellent place to start. So that is what we are chatting about on today's podcast, is kind of some different case studies and ideas that are going to open you up to understanding more clearly how to prevent bouts of lower back pain, both in yourself and in your clients if you are a practitioner. Now, there is a huge body of research when it comes to back pain and discs and all of that jazz, and all of them have a really great framework through which you can view a problem. Today I'm going to chat a little bit more on the personal experience side of things with my clients, with myself. Certainly I have read lots of that research. I could even direct you to actually a paper that I wrote with some colleagues that was published in 2019. It was published in the Journal of Obstetrics and Gynecology, and we were talking about the prevalence of lower back pain, pelvic girdle pain in a postpartum population. So I am super interested in the things that lead to a lower back problem. And what I want to draw your attention to more specifically today is surgery through your abdominal cavity leading to back pain in the future. I'm not going to tag a ton of articles in this because I am sharing this as a practitioner and someone who has watched the course of a lot of lower back injuries play out. I'll cite any papers that I believe are reasonable to follow up on and observe based on this topic. But I just want to chat about a couple case studies and some considerations for, again, both you and your clients when we're talking about back pain. Obviously, we want to be collecting a health history. In my younger days as a practitioner, I was kind of just doing it to check off the boxes, if you know what I mean. Once I learned that many of these conditions could set the stage for a cascade of events that became back pain later, started to pay attention a little bit more, Hey everybody, just jumping in to let you know my 4-Day Fix program, a completely free 4-day online workshop, is just around the corner. This time we are going to be covering all things neck and shoulder. So if you are someone suffering from chronic neck pain, chronic shoulder injuries, or if you are a practitioner who works with clients and you want to clean up your methods when it comes to treating those issues, jump into my show notes and get registered for this free 4-Day Fix program. Back to the show. I want to share with you a couple of different case studies that come to mind about a kind of cascade or precursing event that has led to back pain in their future. Because essentially, if we've done anything to change how forces are traveling through the abdomen, through the spine, it's going to change how that spine loads. And when it happens in something like a surgery, it's a fairly abrupt change in how that pattern of load is happening. And I want to bring to your attention a case that I had of a powerlifter who came to see me, and it was in about late January, early February one year. He lifts a significant amount of weight generally, And he had come to see me because he was having symptoms of a disc herniation. So pain down the legs, pain in the back. And in his mind, it had started suddenly and out of nowhere. As soon as someone says that to me, as a practitioner, I go, okay, we're going to have to go on a mission and uncover the cascade of events that led to this, because nothing happens out of nowhere. Actually, it was probably 30 minutes into the appointment because I was kind of pulling through some of the history. I had worked with him before, so we were kind of getting to work trying to alleviate some of the symptoms. Yes, we were doing an assessment, but really, day one of any sort of disc or back pain, when someone's coming in with a lot of pain, we're going to do a bit of assessment to clear out anything scary, but really we're trying to get their nervous system to calm down. That's step one. We got to calm down to actually see and listen to what's going on, because right now there's just fire alarms going off. We can't actually quiet down and see. So as I continued to assess him and do some gentle stuff to try to calm down his nervous system, it came to my attention that his appendix had ruptured over the holidays. And the reason this is important, and it was the tiniest incisions. But the reason this is important is when you have those tiny incisions, they completely change your capacity to brace your abdomen. Now, for someone who wasn't lifting huge amounts of weight, you might have just been able to carry on in your normal day-to-day life, and it wouldn't have had any impact on your life. But when we put that into the context of really, really high, heavy performance loading, those little teeny tiny incisions become hugely impactful for how forces are traveling through your body. I'm going to link one of my favorite videos that kind of shows you the role of the thoracolumbar fascia and its connection to the transverse abdominis, and really that this pressure cylinder that is your abdomen essentially extends your back. So when we breathe and brace onto our abdomen, what's happening is we're creating actually a pulling force in the thoracolumbar fascia. So the pulling of your back bones and joints through this thoracolumbar fascia is actually what is extending your back. That is because it has way more leverage than the actual erector muscles of your back, which are very small and short. If you are observing anatomy takes the shape of its role. And so those little erector muscles of your back are really more to do with proprioception, so awareness of position, than they do with load and force management. Really long, superficial, like the thoracolumbar fascia. And that thoracolumbar fascia is also controlled by the glutes, which is one of the reasons why strengthening your glutes can help with lower back pain. This pulling of that fascia is actually what is supporting the most force when it comes to lower back stability. And so we can understand that movement through the spine itself that is not effectively supported can contribute to additional force going through a disc. And so what we want to understand is, because of that incision in the abdominal casing, this leads to a change in how force and pressure is managed through the thoracolumbar fascia and the abdominal cavity. And so your capacity to generate and hold intra-abdominal pressure, which is, if you sat here and you took a deep breath in and you blocked your throat and you just braced, bared down, that's intra-abdominal pressure. If your body doesn't trust to push into that pressure because it feels the stitches, whether you're consciously aware of it or not, your body would feel an incision and stop you from pressurizing it. Essentially what's happened is it changes how your back is loading. And one of the challenges that we're going to see is that the thoracolumbar fascia is not going to load as effectively, which means more is going to be asked of those little erector muscles in your back and your QL muscles. And if you haven't been training that tissue to load, so this example of the powerlifter, he hadn't been training those muscles because he had used a fascia dominant strategy up until the point that he couldn't. When he went to try to go back to lifting the same weight that he did, it wasn't the same structures lifting that weight. And that is what actually led to the overload of the disc. Now, I bring this up on this podcast for two reasons. One is for practitioners, so that you are aware to observe that little "did you have surgery" piece. A reminder to ask, because some people won't talk about it or even think to fill it out. And then the second is, if you are someone who is going through any sort of surgery, I can think of a handful of people in my client base right now that are getting joint replacements, have had surgeries for various reasons through their abdominal cavity, C-sections, hello, any sort of surgical incision. We need to make sure that we are addressing that site of incision and that we are reintegrating your movement into that new pressure system, right? I think a lot of emphasis in post-surgical care is focused locally. So again, if it's like a hip, knee, joint replacement, joint surgery, the focus becomes regaining strength at that joint. But we need to remember that that joint exists in the context of a full picture. And so we have to start to introduce this site of incision, this site where there has been local focal trauma, and bring it back into the context of the rest of the system. Because if you don't purposefully do that, your body is going to automatically do that. And the strategy that your body defaults into is probably not going to be sustainable, because it's not going to expose itself to pain, which we need to do to reintegrate that system, right? And the tough thing is oftentimes people will perceive a lack of pain. So if we use the example of like a C-section, I think some people will use the idea that there's a lack of pain perhaps at the C-section scar, the site of incision. Maybe they're like, that feels fine. People often forget that your body is going to guard you from pain. So sometimes things will feel fine because your body has stopped asking them to load. So that is really what we want to start to gain an understanding of, is, does that tissue feel fine in all forms of loading that you're trying to do in your life? Or does it feel fine at rest? Or does it feel fine at low stress? The other thing we want to be aware of is maybe the actual incision site is not painful at all, but suddenly you're getting this new pain somewhere else. We want to start to understand that there is an order of operations, and we want to look at these timelines of things happening, because that force is going to be moved and transferred somewhere if your body is not trusting to put it at the site of that incision. A few other examples that I can think of would be someone getting any sort of surgical incision for some sort of cancer treatment. Could have had cancer removed from different organs, maybe endometriosis removed from different organs. Some of those involve those changes to the structure based on the incision site itself. But some of those are changes based on a change in the actual like mass and structure in the abdominal cavity. So I've seen people with fibroids removed, endometriosis removed. Yes, there may or may not be a site of incision depending on where these problems were, but there's a change in the pressure system because of that physical structure being removed. Now, I'm not saying you have to bubble wrap yourself if you've had some sort of surgery or something removed in your body or added into your body, but there's a time that we want to bring observation back into the movement system so that we can see and feel how forces are traveling through your body. We don't want to wait till you're at the point of pain or you're at the point of damage to start to reintroduce that movement pattern and make sure things are flowing effectively in your body. You don't have to wait. You just have to have an awareness that if you are going for a surgery, yes, if you're going for a joint surgery, something like that, like a joint replacement, etc., yes, do the local, intervention at the site to regain strength around the joint. But if you're getting an incision anywhere in your body, you need to teach your body how to reconnect movement through the system as a functional unit. Injuries or movement in one area of the body influences the entire movement system. And so if we're not purposefully reintroducing those pieces into the entirety of the movement system, there is a good chance they're going to fall into a place that isn't going to have a huge capacity to manage those forces. So that is all I have for you today on this topic. But what I would like you to take away from this is pain is a late stage indicator of a problem. And if you have had any sort of incision or trauma to your body, if you do not purposefully reintegrate movement into that area that has been, cut, damaged, changed, it's going to go somewhere else. And you can wait until there's pain to start to figure out where that's going to be, or you can purposefully shape where that movement is going to be pouring. So my suggestion to you is to purposefully do some work to reintegrate that isolated injury in with the entirety of the system before it has to become an issue. And if you are working with clients and you preemptively, they're going in for some sort of surgery, it's a beautiful time to go ahead and play around with fascial tension lines, start to integrate some of those movements. You can start to match them with some of the activities they're trying to get back into. The program that I run is an 8-week program called the Posture Revival, and essentially it does just that. We look at how tension lines and movement is traveling in your body, and we do our best to make sure that no stone goes unturned. We're observing how your foot pressurizes. We're observing how your hips move. We're observing how your rib cage, your pelvis, your head, your visual system, your vestibular system, all of these things are moving as a collective unit to decrease the likelihood of particular hotspots based on load distribution. So if you are someone who has had surgery, if you are someone who has had injuries after surgery, my 8-week Posture Revival program is amazing. If you are a practitioner looking to learn how to do this in your own practice, I also have options for you as well, which I'm going to link in my bio. Thank you for tuning in today. I will chat with you guys next time. Have a good one.